pronounce them, so you'll know the most common pronunciation for most of these word parts. Okay, and that's what we'll do first this morning, and then we'll get into chapter 2. When we finish today, we'll be ready for our next test. I'll activate that today as well, and make sure you get that test done before, or this evening would be perfect. Don't wait on that. So get that test done this evening, the one that's already activated over infection control and bloodborne pathogens. You have the review, you have the code. Go ahead and get that done. All right, so let's go ahead and take a look at these word parts that I sent out. There'll be about 40 or 45 or so root words, and then approximately 25 prefixes, 25 suffixes, and then some abbreviations and acronyms. So it'll come out about 100 items or so. They will be tested on separately. So you might want to have this in your notes somewhere, that next week we'll have a test over the root words by themselves. And how do you recognize a root word? /O. Okay. The second test will be over prefixes and suffixes together. And the third test will be over abbreviations and acronyms. So you don't overstudy for any one of them. Okay. The first test, root words, be about 2 pages of those. The second test will be prefixes and suffixes together. And the third test will be abbreviations and acronyms. And we'll be doing those next week. So, and I'll mention it again as we go. I'll let you know when we get to the end of one. You download this on your device. You can highlight it. You can print it and put a line across it, whatever, to let you know where one test ends and the next one begins. All right. So on our first test next week will be the combining forms, also known as root words. Now, I will be using those two terms interchangeably. I know that technically there's a difference between a root word and a combining form, but for discussion, root word. It's just easier to say root word. So whenever I say that phrase, I'm talking about this thing right here. I know that that's a combining form and that arth is the root word, but whenever I say root word, I'm talking about this setup right here. Okay, so I'll go through probably each one and give you an example of a medical term that contains that part. So let's start with the arthro, which means joint. We used that yesterday in some of our examples like arthralgia and arthrodynia. And then another example would be arthritis. Arthro means joint. So arthralgia would be pain in a joint. Arthrodynia, pain in a joint. Arthritis, inflammation or infection in a joint. And I'm suffering a little bit of that. I got arthritis in my spine now, man. So yeah, my back hurts all the freaking time, pinching nerves and all that kind of stuff. So anyway, arthro means joint. And osteo is your bones. Osteopath or osteopathy would be disease of a bone. You know, pathy means disease. Osteopath, disease of a bone. Osteomalacia would be softening of a bone. And you'll have both of those as your suffix, as a couple of your suffixes. Malacia means softening. So osteomalacia, softening of the bones. Hystero, we used that one yesterday. Hystero means uterus. And if you have flashcards, you could go on and just do them now as we're talking, if you can write fast enough. Hystero means the uterus, as in hysterectomy, surgical removal of the uterus. Hysteric, pertaining to the uterus. As a matter of fact, there's something I usually cover right here, or I usually mention right here. Not part of your testing, but just kind of showing how medical terms work and why some terms just don't work for me personally. For example, the term hysterical. If we break this word down, it would be hystero. Let me type this way. Hystero plus ick plus all. Hysterical. See how it works? The I is a vowel. Drop the combining vowel, and you end up with hysterical. But what do you see about this? There are two suffixes on there. Ick and all are both suffixes. And they both mean the same thing, pertaining to. So hysterical, that word literally means pertaining to the uterus. So this is where sometimes people take these terms and they jam them together, and they're not doing it right. When somebody is hysterical, what we should be saying is that person is hysteric, pertaining to the uterus. We don't need two pertaining tos on there. It pertaining to the uterus. Hysteric, all. The all is not necessary. The patient is hysteric, not hysterical. So that again is using the language, but not necessarily understanding how it really works. And I will show you some mistakes in your textbook today, especially today. There's one mistake in there that really just gets under my skin, and we'll be talking about that today. Cyano. Cyano means blue. It's one of our colors. In cyanosis, the condition of being blue. Cyanosis. Now, when I used to do this in the classroom, I would write these examples on the board, and students would say, well, Ms. Mo, and students would actually study this, okay? Well, I studied the word. No, you need to study the word part, okay? So they were misunderstanding what it was that was important for them to study. So I thought about, I just put examples of each over here, but then I'd have people studying what was over there and studying the wrong thing. So that's why I don't have examples actually typed in here like arthritis and osteomalacia and hysterical and . When I tried that, people studied the wrong thing. So I'll just speak about those. So cyano is blue. Notice in this next one, the root word has one E, but the organ has two. Spleno is your spleen. Now some of them will be obvious. For example, an example of spleen would be splenitis, or the one we actually used both of those yesterday, splenitis and splenomegaly, enlargement of the spleen. Now the colon, some of them will be obvious. The colon, first of the colon. Utero is the uterus, and so on. So some of them will be obvious. Make sure that you're studying the ones that are not so obvious. The ones that you can pick out, you know what? I might not even make a flashcard for that one. Colon, yeah, that's the colon. It's pretty obvious. Vaginal, yeah, that's vagina. Yeah, that was pretty obvious. So I might not even clutter my study with those terms. Maybe if you're using a list, just highlight them and just kind of jump over them as you do your study. Entero refers to the intestine. Now, on your review, it might say small intestine. Remember that colon and large intestine are the same thing, and intestine and small intestine are the same thing. The reason that is like that is that these two, they're really trying to get away from using those. But there are too many old people around who still refer to this as the large intestine. But they're trying to get to these two terms, the colon and the intestine, the small versus small intestine and large intestine. So know that they are the same thing. On your test, it might say entero, small intestine. So know both of them. Intestine and small intestine are the same thing. Colon and large intestine are the same thing. Dermato refers to your skin. I didn't give examples of these two. Colonoscopy, to use a scope to look in the colon. or enteritis, inflammation or infection of the intestines, enteritis. Remember that rule, entero plus itis, drop the O, enteritis. Okay. Dermato is our skin, dermatology, the study of the skin. But derma can also be used as a kind of or excuse me, putting the two together, erythroderma, red skin. So dermato is our skin. Myo refers to the muscles. Now there's another one on here of myco. Don't get them confused. Myo without the C is muscle. Myorexis would be a ruptured muscle. Okay. Rexis means to tear or rupture. Myorexis, a torn muscle. Myocell are the cells of the muscles. Thrombo means blood clot. Make sure you get that right in your study material. Blood clot, not clock. I get that sometimes, blood clot. Because in the classroom, you would be I'd give you a list of these and you write in what each one means. On the quizzes, it'll be multiple choice. Thrombo is blood clot, like thrombosis. Osis is abnormal condition. Deep vein thrombosis. They have a blood clot in the deep veins of their legs. Or thrombocyte. The clotting cells in our body, the thrombocytes. So thrombo means blood clot. Every now and then when drawing blood, you'll encounter a thrombosed vein. In other words, a vein on the person's arm that has a blood clot in it. How do you know that? The vein will be hard and it will be distended. So you'll be able to feel like a little rope running down their arm. Like, oh man, that's a thrombosed vein right there. And I mean hard. So it's like, it literally is like a rope underneath their skin running down the arm. If you touch a vein, it's supposed to bounce. Oh, look, yeah, that's a vein right there. You touch a thrombosed vein, it feels like a little string or rope under there. Wow, a thrombosed vein has a blood clot in it. Cephalo means head. And if you wanted to get more specific, a term that y'all might have heard before is inside, BH, encephalitis, inside the head. EN, inside. Itis, inflammation or infection. Encephalitis, inflammation or infection inside their head. And I'm going to stop using the keyboard and I'm going to start writing because I write a lot faster than I type. So cepho means head. Erythro is red. Like in, let me use red. Like in erythrocyte or erythroderma. I can't write off the side, my bad. All right, so erythrocyte are red cells, red cells. And cut me a little slack is what I'm writing. If I misspell something, I'm not going to be going back trying to correct spelling and that type of stuff so we can get this done. So erythro is red. Does anybody do that when you type? I learned from one of my bosses when I was in the Air Force that when you're typing, if you see that you've misspelled a word, do you know how long it takes you to go back and respell that word? That's why people take so long to type. However, if you just leave it and keep going, it doesn't take very long at all to go back to each one and correct them when you're done. So he would never go back, and we'd be sitting there working on a document or whatever. I'd be saying, okay, boss, type that. And he'd type, and I go, you misspelled it, I'll get it. And he keeps going. So I'm not going to go back and change all the misspellings. I'll just keep going. All right, phlebo, it refers to our veins, like in phlebotomy. Tomy is a surgical incision. So when you perform phlebotomy, you're performing a surgical incision into their vein to withdraw blood. So phlebotomy, or phlebo, meaning vein. Patho means disease. It's one of our more common word parts. I think itis is the most common word part that we use as far as suffixes go. As far as roots, I don't know, maybe patho, because you can have a disease of anything, like in cardiopathy or pathology, the study of disease. These guys are and girls are kind of like the CSI of the hospital. Okay? And y'all, if anybody watches CSI or whatever, you know, they're taking them over to the coroner's office. The coroner is a pathologist, a person who looks at these bodies and tries to determine why they died. Now, wouldn't that be a cool job to have? Yeah. Trying to catch people, you know, for example, somebody died under unusual circumstances and they're looking at you, or they go, oh yeah, this guy committed suicide. No, he didn't, because this guy is right-handed and and the bullet shot came from the left hand, and nobody would ever commit suicide with their non-dominant hand, and I'd be like Sherlock Holmes on their ass. So that's what one of the things a pathologist does. So they study disease. So, and also the pathology department is also the department of the hospital where we send samples for them to look at and call us back and tell us whether that is a tumor or a cyst. So pathology is a huge department. It's not just the people who do the autopsies. It's also people who are looking at tissue samples being sent in by doctors and clinics and telling them that that's a tumor or that's a cyst or the pap smear is clear or whatever. So that would be your pathology department in a hospital or clinic, the area that studies disease. Now, a lot of people get this one wrong. Cervical. Cervical refers to the neck, not the cervix. Cervical is neck. Now, if you ever seen that white collar they put on your neck after a car accident or falling down the steps or something, that's called a C-collar or cervical collar, a neck collar. I believe it or not, those come in 3 sizes. And the sizes are short neck, or excuse me, no neck, short neck, or long neck. And believe it or not, most people wear a no neck C-collar. I always thought that name was kind of weird. No neck, short neck, and long neck. I have never put a long neck collar on somebody. Those things are like, boy, you gotta be like damn near a giraffe for that thing to fit you. Most people are no neck, the little bitty one. All right, so that's your cervical collar. The bones of the neck are called the cervical vertebrae, pertaining to the neck. Hepato means liver. Now we should have that one by now, with all the hepatitis we talked about. Hepato is your liver. Hemo is blood, as in, oh shoot, hemo, I think we put this word up yesterday, hemolysis, breakdown of the blood cells, hemolysis. Now you should also know, and you know what, I may just go on and keep this one in here. Hemo and hemato both mean blood. think I want to go and save that one in there. Hemo and hemato both mean blood. And I might do that a couple more times because I think I want to do that with the kidneys as well. Hemo and hemato both mean blood. Cardio refers to the heart, as in endocardium, electrocardiograph. And you know, we're doing something with their heart. Echocardiogram. You know, we're doing something with their heart. Cardio. And that's probably the most recognizable of the word parts. You say to anybody, whether they are healthcare or not, you say cardio, people usually know what you're talking about. Cholecysto refers to our gallbladder. Chole literally means bile, and cysto is bladder. But the old school name for bile is gall. Therefore, the term is translated to gallbladder. It literally means bile bladder. But the old school gall stuck and is now referred to as the gallbladder. But it's where bile comes from in the body. Cholecysto, your gallbladder. Like in cholecystolith, ISIS, S-I-S, cholecystolithiasis. You have a gallstones, cholecystolithiasis, gallbladder stones. All right, leuco is white. Leukemia. Emia is a blood condition. That's also one of your suffixes, part of your testing. Emia is a blood condition. Leukemia is a blood condition affecting their white cells. Leukemia. So leuco is white. Another obvious one, thyroid, refers to the thyroid gland. Thyroid is thyroido is a thyroid gland, like thyroiditis. Thyroiditis, inflammation or infection of the thyroid gland. Pleuro refers to our lungs. Pleuritis, inflammation or infection of the lungs. Now, with all these roots, guys, you can almost go to the vast majority of them and stick an itis on the end. And it'd be a term that people would know because itis is the most common of our suffixes. I try not to overuse it, but I could just keep going. Gastritis, craniitis, cystitis, myelitis, salpingitis. I could just itis every freaking thing in this list, pretty much. All right, so let's do this. And let's see who's here. Got 17 people, so we're missing a couple. Roxanne, you here? There she is. And then Talisha is here. She had to go and do something. No, that was Dee Dee that had to go and do something. Where's Talisha? Talisha, oh, there you are. I see you. Okay. That was Dee Dee that had to go. Karanisha. I don't think this child's going to start. Karanisha. Okay. Jordan is here. Didn't I see you? Where'd Jordan go? Oh, there you are. And then Yordell is here. Renisha is here. Still no. Okay. They probably won't start. Jennifer Green. Where's Jennifer? Jennifer, I see you. Okay. And Davion is here, and so is Jaime. Where's Jaime? All right, there you go. And then Jasmine is here. Linda is here. Melissa is here. Is Melissa here? Oh, there you go. And then Vanessa Pargas. I'm not seeing Vanessa. Vanessa. Okay. And then Vidalia. Where's Vidalia? Vidalia's not here. Okay. And then Selena. There you are. And Angel Myra. Alma had an appointment. No. Did she? Alma? Yeah, she had an appointment. And then Crystal is here. I think I saw, there you are. And Savannah is here. Denisha had an appointment. And then Angel Ramos. Where's Angel? There you are. Okay. There it is, guys. I knew, let me go ahead and send this email. And I just found what I was wanted to mention today that was in the news. So let me do this first. There's the 20th. All right, so the ones that I'm missing are Butler, Karenisha, Erica De La Rosa, Vanessa Pargas, Vidalia Perez, Alma Segovia, and Dionysia Wilson. So Vidalia, Vanessa, Erica, or Karenisha? Anybody? 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 All right. One more in here. And set. All right. So we mentioned that pleural meant lungs. Gastro is your stomach. Then gastritis or gastric bypass pertaining to the stomach. Excuse me. Cranial is your skull. And make sure you're making that distinction between head and skull. Okay. Cephalo is head. Cranial is skull, the actual skull bones. All right. So this is what I saw in the news, something that I mentioned yesterday. And in case you need to reference this, it's called the CARES Act extension. And it authorizes employees, either full or part-time, to take up to 80 additional hours of sick time. specifically to work with your or stay at home with your children who have to be at home. It's called the CARES Act extension, and it authorized up to 80 additional. So that's 2 weeks, 80 additional, and like 4 weeks if you're part-time, additional paid sick hours, specifically to stay at home with children who have to be in virtual school. So if you're in that position, talk to your manager and see what's going on with that. And someplace in there, I didn't catch it real well because they said it real quickly. And I watched the news a couple times yesterday. The second time trying to catch it and still didn't catch it. There's another 180 hours authorized for something. I couldn't catch what that was all about. So that 80 additional sick hours, guys, I don't know if that's monthly or what, but find out what that is and see if you can take advantage of that. So the first place to person to talk to would be your human resources department. Listen, I want to ask some questions about the CARES Act extension that authorized extra time for taking care of, my kids in their virtual classes and stuff. All right. So anyway, the other thing was that the wildfire. Yes, go ahead.
I'm sorry. I have to run up to the school for my kids right now to get them their laptops because we're having trouble. So they need me to go get their laptops right now so they can be going to class.
Okay.
All right. I'll be back in like 15 minutes. I'm sorry.
Right. Okay, no problem.
Thank you.
And the wildfires in California, y'all, are that close to my wife's home. Her sister and brothers are having to pack up stuff and get out of there because it's burning in a city called Vacaville, and that's right next door to my wife's hometown of Fairfield. So they're packing up and moving out of there so they don't get burnt up. So anyway, keep our fingers crossed about that. The house my wife grew up in, and that's what she's like, oh, the house she grew up in is in risk of burning down. So that's the other thing in the news. All right. So anyway, and that's one of the places I'm going when I go home. I'm at least going to drive past the big house. The house I talk about where my grandparents lived and all of us lived at one point. I'm at least going to drive by there just to see the big house and relive some of those memories. That's the kind of shit you do when you get old. What?
I don't need you sitting like this far. Go that way.
Well, one day y'all gonna leave y'all microphone on and gonna forget, and I'm just waiting for the day that somebody go, damn, Mr. Mahone kind of asshole. Girl, I'm dealing with this asshole teacher. Y'all leave me alone. Watch. You watch. What are y'all gonna leave your microphone on one day and gonna get busted? So anyway, like I said, that red button down there, y'all, that's the most important thing to y'all. And yes, I have had the microphone on, having a conversation, didn't realize the microphone was on. I didn't say anything bad. It's just that I turned around. Oh man, the microphone been on this whole time. Talking to Miss Paz in the classroom. Yeah, it does happen. So anyway, but we didn't say anything, bad or anything like that. I'm looking at this, and there is one that's catching my mind. I'm gonna have to change that when I get down there. All right, so cranioskull, cyto is cell, like in cytology. This is the area in the lab where you send cell samples to determine whether those cells are cancerous or not. So your pap smears are all sent to the cytology department, where they look at the cells to see if they're precancerous. Cytology, the study of the cells. And that's what a cytologist does, his specialty. So cyto is cell. Myelo, that refers to your bone marrow or your spinal cord. It's just odd that in Greek, myelo means one thing. In Latin, the same word means something different. And when one is bone marrow, one is spinal cord, it doesn't matter which is which, but that myelo is one root that has two meanings. So if you see, and healthcare recognizes both of them, if you see this term, for example, myelitis, you're going to have to do some further investigation into the record. Is that infection of their bone marrow or infection of the spinal cord? Because remember, you can have an itis of it, just about anything. And that's the word that the color that kind of caught y'all off guard yesterday, poliomyelitis. Inflammation of the gray part of their spinal cord in that case, poliomyelitis. So myelo is either bone marrow or spinal cord. If you break your bone, you might end up with myelitis, infection of the bone marrow in there. So when you see that term, you're going to have to do a little bit more research. Are they talking about the spinal cord or the bone marrow in this case that I'm reading right now? All right, so that's myelitis or myelo, bone marrow or spinal cord. Now this is one that I need to change. No Y in there. Litho means stone. Like in otolith, the stones of the ear. Lithiasis, abnormal condition of stones, usually kidney stones or bladder stones or urinary tract stone or urinary stones. So litho is stone. Salpingo refers to the fallopian tubes, which are also called uterine tubes. So it's the same thing, fallopian or uterine tube. Salpingectomy, surgical removal of the fallopian tubes. Athero refers to plaque. Plaque is a hard buildup that happens usually in our blood vessels, in our kidneys, in our brain. We build up hard just coatings on things. You have plaque in there. If you have plaque in your arteries, we call it hardening of the arteries. Atheroma is a tumor that grows out of the plaque that builds up in there. All right. Atherectomy, surgical removal of plaque, usually done from the arteries in your neck. I'm probably going to need one of those soon. So athero is plaque. Arterio refers to our arteries. Arteriostenosis, narrowing of the person's arteries. Arteriosclerosis, hardening of the arteries. Sclero, hardening. Arteriosclerosis, hardening of the arteries. That's a mistake in your textbook. Your textbook in one place defines sclero as softening. They got it backwards. Malacia is softening. Sclero is hardening. So even when they write textbooks, there are mistakes in there. If you know your stuff, you'll be able to pick those out. Urethra refers to the urethra. Oh, look, I already did it down here. Let's do it this way. Urethra is the tube that leads from the bladder to outside the body. And I'll just use a quick one, urethritis, inflammation or infection of the urethra. And that's another obvious one for you. Urethra means urethra. All right. Nephro and reno both mean kidney. You can have a nephrolith, It's a kidney stone. Hydronephrosis, abnormal condition of water on the kidneys. Nephrolith, kidney stones. Renal cell carcinoma. A kidney tumor, renal cell carcinomas, or the renal dialysis. Both word parts meaning kidney, nephro and renal. Have to be diligent about erasing these because I don't want to save and accidentally save some of this stuff on there. All right, so nephro and renal both meaning kidney. Orchido is the testes. Orchiditis, inflammation or infection of the testes. Or orchidectomy, surgical removal of the testes. And you see it is spelled just like the flower, orchid, orchido, testes. So next time guy gets fresh with you, kick him in the orchids. All right, pancreato refers to the pancreas, another obvious one. Pancreatitis. Cysto means bladder, like cystitis. A cystolith, a bladder, stone in the bladder. Necro means death. Necrosis, abnormal condition of tissue death. Necrosis. Necro is death. Adeno is gland. Adenoma is a tumor on a gland. And then there's your itis again, adenitis, inflammation or infection of a gland. Adenectomy, surgical removal of a gland. Oophoros is the ovaries. Like you might have an oophorectomy, a surgical removal of the ovaries. That was a Jeopardy question one day. The doctor performs an oophorectomy, or this is the organs that are being removed when a patient has a oophorectomy, ovaries. I like when I see those kind of questions on Jeopardy because I can answer them. I know that one. In our house, you get a Jeopardy question right, you get to dance around the house and just be like the man, like ooh, 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 ooh. So imagine one day when the category was medical terms. Boom, y'all. I was like, bang, 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 boom. Ah, who the man? Oh, well, you sit down and be quiet. No, you know don't be hating just because I'm better at Jeopardy than you are. So anyway, we get stupid if you answer Jeopardy question right. Ureter refers to uretero refers to the ureter. That's the tube that goes from your bladders down to your kidney, or from your kidneys down to your bladder. The ureters. Another obvious one. Myco means fungus. Oto, myco, otomycosis, condition of fungus in the ear fungus. Otomycosis. or I don't know, what was the other one that just came to mind like real quick. Anyway, myco is fungus. Meningo is the meninges. There it is. Another obvious one. Meningo is the meninges. As in the term y'all have all heard before, meningitis. Colpo is a vaginal canal. Colporexis. Yeah, I remember we talked the other day about those tears that happen in the vaginal canal during intercourse. Those tears are called colporexis. Tear or rupture, colporexis. In this case, the tears or ruptures are happening in the vaginal canal. Utero is also the uterus. You know, I could actually put those two together, utero and hystero, rather than having them separate, because hystero is way up here. So utero is also the uterus. So I didn't sleep too well last night. I don't know. I just didn't sleep good. All right. So anyway, that is the end of the first test. The root words. So go ahead in your notes and write test 1 or whatever. Turn to a new page and start a new list. If you printed it out, put a line across here. You see it's in red right there to show you which one is which, or where the next one starts. Make sure you get that predominantly in your notes somewhere so you don't overstudy and study the wrong part. All right, second part is going to include the prefixes and suffixes. And up here, I think what I'm going to do, since we're close enough to the next page, just do it that way. That ends the and then the next page starts the next test. All right, and I'll do that. All right, for the prefixes. Starting with a or an, they both mean without, like anemia. And this is actually a medical term that has no root word. This is a prefix and a suffix. Anemia. Emia is a suffix, means blood condition. So there is something missing from their blood, anemia. If something is asymmetrical, without symmetry. So a or an, something's missing. Anhedonia, without pleasure. Anhedonia is one of the symptoms of having depression. The people will suffer anhedonia, no pleasure in anything, without pleasure. So a or an both mean without. Something's missing. Neo means new, as in the Matrix. The main character called himself Neo, the new one. Neonatal, new birth. Neoplasm, new growth. Tumors are neoplasms. Something you wasn't born with that grows on you. Like I say, we don't like to see new things growing on old people. New growth, neoplasm. Anti means against. Antiseptic, against microorganisms. Remember, sepsis is microorganism. Against microorganisms, anti. Anti-diarrheal, against diarrhea. All right, Brady is slow. Bradycardia, slow heart. Bradypnea, slow breathing. Bradykinesia, slow movement. DYS, pronounced dis, means painful, difficult, or bad. Dysfunctional. Dysuria. Dysmenorrhea. Painful, difficult, or bad. Bad menses, or excuse me, bad function, painful urination, difficult menstruation. Painful, difficult, or bad. Bad function, painful urination, difficult menstruation. Painful, difficult, or bad. Mal means abnormal, as in malfunction, or malignant. Abnormal growth. So that's the word you don't want to hear when somebody says you have a tumor and it's malignant, means it's bad, or abnormal, or that's bad. Malignant, malfunction. So anyway, abnormal, mal. Hyper, excessive or increased. Hypertension. High blood pressure. Hypertension. Excessive or increased. Hyperactive in hyperactivity. Attention deficit hyperactivity or hyperactive disorder. Increased activity. Tachy means fast. tachycardia, fast heartbeat, tachypnea, fast breathing, pre means before. Wait a minute. Oh, we're doing the prefixes. It's like, how did we get the prefixes? So we're doing the prefixes. Pre means before. Pre-op, prenatal, it's happening before whatever you're mentioning, prenatal, before birth. Now, there are a couple that I don't want you to mistake, and they're easy to do. Intra and inter. Don't get them mistaken. Intra means within. I had to change it from endo because if intra, remember that within and inside mean the same thing, but I didn't want to have inside and then inside the body. People were getting those mistaken. So instead for intra, I used the word within, but within and inside are the same thing. And an example of that would be intracellular, inside the cells, versus intercellular, L-U-L-A-R, inside or between the cells. There are two types of fluid in our bodies. Intracellular fluid, the fluid inside the cells, and intercellular fluid, the fluid between the cells. So don't mistake those two. Intra is within, inter is between. So if you are, we'll be using the terms next week, we'll be using the terms intrapersonal and interpersonal. Intrapersonal refers to somebody who is withdrawn or an introvert. Intercellular means that people who interact with other people or between two people. So intra versus inter. Then people often confuse anti and anti. Remember, anti is against, anti is in front. Antecubital, the front of the elbow. Or here's a good one, antecedum, before meals. Or that should be an I, I'm sorry. That's the other type of sebum. That's the stuff that comes out of our tissues. Antecedum, before meals. And that's why in your abbreviations, AC means before meals. Have a patient take this medication AC before meals. Anti. Peri is around. We use that one a couple times in class. Like in pericardium, around the heart. Periosteum, around the bones. Poly means many. That was one of our numbers. 4 or more than 4, we usually say is poly. Many. And polycystic would be an example. Many cysts. Post is after. Post-op. Postnatal. And we've already mentioned that inter means between things. Interstate, between states. Oh, good. I can do, but this is all one. Sub is below. Substernal, below the sternum. Submarine, below the water. Substandard, below standards. Hypo is low or decreased. The opposite of hyper is hypo. And that was one of the homework items we looked at yesterday. They said state the prefix that means the opposite of hypo, and it is hyper. So hypo, low or decreased. Hypotension is low blood pressure. Hemi means one side. Now, people often confuse this one. Hemi doesn't mean half. Hemi means one side. Remember, half can be above and below. Hemi says left or right, so one side, left or right. Hemiplegia, paralysis on one side. EU, pronounced U, is normal or good. Eupnea, normal breathing. Euthanasia, good death. That's what we do when we're euthanizing animals, giving them a good death. Euthanasia. We use that so we feel good about doing it. Euthanasia. So EU is good. And endo, inside the body. And let me clarify this one a little bit. I didn't want to get too drawn out with these actual descriptions or definitions. But endo is one that could be drawn out. Endo can be inside of anything. You see why I didn't want to get confused with intra, inside, within, and then endo, inside. Well, okay, inside the body, a little more specific. But it can also be inside an organ. For example, endocardium, inside the heart. Endoscope, the scope that's used to look inside the body. So endo can be inside the body or inside a particular organ. Endogastric would be inside your stomach. Endocranial, inside the cranium. So we use the description here as inside the body. So it wouldn't get confused with just plain old within or inside. All right. And there we're going to take a break. I want to go down to the next page. Yeah, let's go down to the next page. All right. And we'll come back from break, we'll do the suffixes. It's 10 after, come back at 25 after, give us 15 minutes. 25 after. Okay, I'm back. Uh, a couple minutes early, but we do need to get this list done. So I'll go a little quickly from here out again in interest of moving on because we do need to get chapter 2 done today. So as for the suffixes, algia is pain, like in cephalgia. Arthralgia, pain in the joint. Cephalgia is a headache, pain in the head. Hernia is cell, like a myocell, herniated muscle. Synthesis, puncture to remove fluid. This is if you had an amniocentesis when you were pregnant, they punctured the abdomen and pulled out some of the fluid in there. Or a arthrocentesis, they pull fluid out of your joint, usually because you ruptured a blood vessel in that area and the blood fills up in that joint. We have to pull that blood out of there. It's an arthrocentesis. We're going to poke a needle in there and pull it out. Some people will have a cardiocentesis, punch a needle in their heart and pull excess fluid out of there. Ectomy, you've heard me use that a few times. Ectomy is surgical removal of something. And when we ectomy something, it doesn't mean that we're doing the whole thing. For example, a craniectomy is not surgical removal of their skull. It's surgical removal of a section of the skull. You've been hitting the head with a hammer or something, and the skull is in pieces right there. They'll do a craniectomy and take those pieces out of there. Anemia is a blood condition. Anemia, septicemia, thalassemia, are all proteinemia are all blood conditions, something in the person's blood. Now, I don't want y'all to confuse TOMI with STOMI. Okay, again, they are real close. TOMI is a surgical cutting, like in phlebotomy, to cut into something. A graph is a machine used to record, and there's another similar one, is gram. Don't confuse those two. Graph, like the electrocardiograph. And let me put them, I separate them on purpose on the list so that you don't get them confused, but they are typically used together. For example, if you want to send a record to somebody, you might send a telegram. I've heard that before, a picture or a communication with somebody, a telegram. What's the name of the machine that you'll use to send a telegram? You use the telegraph. So if you want to produce an electrocardiogram, the machine is called electrocardiograph. So the machine, the graph, produces the gram, the picture. Electrocardiograph is the machine. Electrocardiogram is what you'll be handing to the doctor after you run it. Pathy is disease, just like patho. Patho is a root, pathy is a suffix. Cardiopathy, disease of the heart. Nephropathy, disease of the kidneys. Lysis, we've used that one in our examples. Breakdown or destruction of something. Hemolysis, breakdown or destruction of the blood cells. Malacia means softening, like chondromalacia, softening of the cartilage. Osteomalacia, softening of the bones. Now, typically, you're not going to have softening of anything that's soft already. So you wouldn't have, for example, arteriomalacia, because the arteries are already soft. So this term is going to be used in those things that are supposed to be hard, like our bones. Osteomalacia, softening of the bones. Megaly is enlarged. Almost anything can be enlarged. Cardiomegaly, enlarged heart. Hepatomegaly, enlarged liver. Stenosis means narrowing. So when you have a blood vessel, for example, that should be wide open, and then it squeezes down, right? That's stenosis. Cardio or arteriostenosis, narrowing of their arteries, usually because all of this is plaque, and it makes the artery narrower inside, and that increases your blood pressure. So stenosis is narrowing. You could also have craniostenosis, where your cranium doesn't grow like it's or spread like it's supposed to. It's too narrow. Osis is abnormal condition. We've used that a few times. Gastrosis, arthrosis, or abnormal condition of those body parts, the stomach or the joints, arthrosis. Stomy is a surgical opening. And let me explain that for a minute. If we do a tracheotomy, that is a cut into their trachea. Remember, tomy is a cut, tracheotomy. Once we do that cut, the hole that we have afterwards, tracheostomy. Stomy, the opening. So tomy is the cut, stomy is the opening. So we do an emergency tracheotomy, and when we're done, you're going to have a tracheostomy right there, the hole. So stomy is the surgical opening, tomy is the cut. Tracheotomy versus a tracheostomy. And people get that wrong all the time. Go down in room 7 and do tracheotomy care. No, you do tracheostomy care. Stomas, openings. Gram is a picture or record. Itis is inflammation or infection. Again, we've said that's the most common of the suffixes. And I don't even mess around with this anymore. It's always going to separate it into it is. So itis, inflammation or infection. Plasty is surgical repair. How many of y'all thought back in the day that when you did plastic surgery on somebody, they were using plastic? I did. They putting plastic in their face. No, plasty, surgical repair of something. So if you do a rhinoplasty, surgical repair or changing of their nose. Mammoplasty, boob lift or a boob job. Plegia is paralysis, like in hemiplegia, paralysis of one side, or paraplegia. Para means one, half or beside. So this is half paralysis, paraplegia. And then quadriplegia, 4 arms, quad, quadra, or 4 limbs, quad, quadriplegia. Paralysis of all 4 limbs. And sclerosis is hardening. Arteriosclerosis. Or multiple sclerosis. Hardening in their nervous system. MS. And that's the one that your textbook actually says means softening. So there are mistakes in textbooks. Sclerosis is hardening. The next section is your acronyms, and that should be on a separate page. Next page down. That is the 3rd test. Acronyms and abbreviations. Now, I'm not going to go through each one of these. What I will tell you is that over here in parentheses, it explains why AC means before meals. It's the Latin for antecedum, AC, before meals. So I did that to show why each one of these, because it seems kind of odd. Why would AC? Why not BM? Because in healthcare, BM means what? Bowel movement. So we have to take all these things into consideration. BM means something else. So AC, and the Latin is antecedum. There are a couple examples of hormones on here because we usually use the acronyms to indicate the hormone that we're talking about. And we'll be doing the hormones in the last week of this module. And we'll be talking about the adrenocorticotropic hormone and what it does. So if it looks odd, if you look over there, you'll see the Latin. Why ad lib means freely or as desired. Ad libitum, the Latin part. All right. Some of your medications, like aspirin. Why is aspirin represented as ASA? Because of the chemical name of the stuff, acetyl salicylic acid, ASA. And this is the way the doctor will write the prescription. Go ahead and give them 85 milligrams ASA and expect you to know that that's aspirin. They're referring to the chemical name of the thing. All of the X's are pretty much taken. In other words, if you put a letter in front of something and put an X next to it to mean a word, all of those are taken. AX, BX, CX, DX, they've all been used. So you can't make up any of those. And BX is accepted as biopsy of something. For example, HX is history, CX is cancel, DX is diagnosis, EX is exemplar or example. They're all taken, so you can't use any of those. You can't make up any new ones. BX is biopsy. Continue, SX is symptoms, TX is treatments, so all the X's are done. Biopsy. To pay attention to the fact that sometimes case, upper or lower case, does matter. CNS is culture and sensitivity. What was the other example? Oh, it was CC. Where was that? There it is. CC is where I need to make that. I'll make that again when we get down there. All right, so CNS is culture and sensitivity. ETOH, that's not a typo. That T should be small like that. Stands for ethyl alcohol. So the doc might ask for a blood ETOH level. What's their blood alcohol level? That's what we do with suspected drinking and driving. They bring you over to the emergency room and they get a blood ETOH level. NPO means nothing by mouth. Nil per, that's not right. Doesn't matter for you, but on your testing, yes. Nil per Oz. Nil per, no, Oz, nothing per mouth. OS. CPR, cardiopulmonary resuscitation. CVA, you'll get it later in your classes. Some of y'all have had it already. Cerebrovascular accident, the medical term for stroke. Patients had a right-sided CVA, had a right-sided stroke, cerebrovascular accident. CXR is chest x-ray. If you've worked in any nursing homes or anything like that, assisted living, you may be familiar with this one. DNR, do not resuscitate. If the person dies, extend no life-saving measures. Just let them go. Do not resuscitate. DX is diagnosis. Remember, all the X's are taken. CC is your chief complaint, and it should be upper CC like that. Lower CC means cubic centimeters. So sometimes case or upper or lower case does matter. Chief complaint. FX is fracture. HCG is another fracture is referring to the skeletal system. You've had a cranial fracture or FX or a femoral fracture. HCG is the human chorionic gonadotropin. That's another one of our hormones. It's the hormone that lets us know you're pregnant. Well, I'm going to get an HCG level. All right, boss. They want to know if you're pregnant. HIPAA, we know that one. We mentioned it. Health Insurance Portability and Accountability Act. This is probably the acronym that is most often done correctly. People want to do this all the time because somebody told them that it's HIPAA like hippo. And then when they do this, they try to make it fit confidentiality. They usually say, what it is, Health Information Privacy and Protection Act. They get it wrong every time. Matter of fact, it was wrong on one of the syllabi when I was teaching over Southern Careers. We didn't make our syllabus ourselves. It was sent to us from corporate, and they sent the damn HIPAA syllabus out with the description of Health Information Privacy and Protection Act. And it took me about an hour on the phone to convince some people that they were wrong. Nobody wants to admit they're wrong, especially on something as basic as HIPAA. Health Insurance Portability and Accountability Act. HX is history. And I often see people do this. PMH. What does that stand for? Oh, past medical history. Oh, really? As if there is a future medical history. Isn't past and history the same thing? Past medical history, whatever. What's the patient's history? BID, twice in day, biz and die. This is also where people try and just kind of make shit up. So why BID? Because by daily. No, biz and die. It's Latin. And it doesn't mean by daily, but it is twice a day. NKA, no known allergies. CDC, Center for Disease Control. NSAIDs are non-steroidal anti-inflammatory drugs like Celebrex, Vioxx, Motrin, or Advil, Aleve, are all non-steroidal anti-inflammatory drugs. APAP is Tylenol. Acetyl para-aminophenol. Does anybody see Tylenol in that word anywhere? Tylenol. Acetyl para-aminophenol. You'll be choosing Tylenol. This won't be there. So don't get hung up on them long words. It's a chemical name. PET or PET, positron emissions tomography. This is a way to scan the inside of the body and not see the organ itself, but see how the organ is working. When we do a PET scan of the brain, we don't want to see a picture of the brain. We want to see what parts of the brain are actually working at any particular time. For example, we play music for you. What part of the brain actually becomes active when you listen to music or when you watch TV? That's what PET scans tell us. PVC is premature ventricular contraction. You're going to have your 3-week EKG classes, and in there you'll be talking about all the arrhythmias, and PVCs is the most common arrhythmia. So I wanted to have at least one example of those on here. Premature ventricular contractions. Everybody will have at least one of these a day. If you drink coffee or eat chocolate or drink wine, you'll have even more of these a day. Premature ventricular contractions, or PVCs. Q has been evolved to mean every. You put Q in front of something, it's every whatever you put it in front of. For example, Q 4 hours, every 4 hours. QD, every day. So put Q in front of something to say you want to do that every of that thing you put it in front of, every 8 hours, every 6 hours, or whatever. Q. And then that word right there, cork, I guess it's pronounced quark, quarke, or whatever. I just gave up on that one a long time ago. But that's the actual YQ means every. That's the Latin word for every. Quarke or corke or however they pronounce it. PRN is as needed. Why does that mean as needed? Latin pro re nata. As needed. So patient is up PRN. They get up whenever they need to. Or take Tylenol, or excuse me, up ad lib. That we wouldn't use that there. For PRN, we would use as take Tylenol for pain, PRN. Take 2 Tylenol for pain, PRN, as needed. QID is 4 times a day, quarter and die. OTC, over the counter. It's important that we use that one when we are, for example, you're at the front desk, patient says they have an upset stomach. You ask them, have you taken anything for it? Yes, I took Tylenol. Patient took Tylenol, OTC. It's important to put that to show that we didn't give them the Tylenol. VDRL, Venereal Disease Research Laboratories. We've got one here in San Antonio. Did y'all know that San Antonio is a hub for syphilis infection right now? Yep, seeing a lot of syphilis in San Antonio right now. SQ and SC both have evolved to mean subcutaneous. Just SQ because it sounds like Q right there, subcutaneous. So either one of these means below the skin, subcutaneous. We give injections subcutaneous all the time. People who do it more than anybody else are your diabetic patients. They put the medicine just below the skin. That's why diabetics are given the medications from the side like this, not straight in. They just want to get it under the skin, subcutaneous. That was also a Jeopardy question too, by the way. Matter of fact, the whole category of Jeopardy questions one day was medical abbreviations. I was all over that shit. Don't mess with me. And one of them was SQSC. They had them both, meaning subcutaneous below the skin. TID 3 times a day, or tear and die 3 times a day. There's another X for you. TX is treatment. CT and CAT are the same thing. So a CT scan and a CAT scan are the same thing. As computed tomography, a tomograph is a map. So they're making a computer map of whatever they're taking a picture of. It used to be computer assisted tomography, a CAT scan. So they took the A out. So CT and CAT scans are the same thing. So this is our layout of how we document in a patient's medical record. You're going to learn all about that. Subjective, objective, assessment, and plan. Okay. The 3 categories you need to document on them. What they told us, what we found out about them through our testing, our labs, our x-rays, our examinations, and what we found out. Based on those 2, what we think the patient has, and finally, how we plan to treat or cure them. What they tell us, what we collect, the assessment, the final arrival of their diagnosis, and then finally their treatment plan. Subjective, objective, assessment, and plan. RSV is a respiratory syncytial virus. If y'all's babies had this, they probably went on, admitted them to the hospital. It's like a cold on steroids. And it does perpetuate the condition or the state of SIDS. So when a baby is usually diagnosed with RSV, we're going to put them in the hospital for no other reason than, simply to observe them. And UA is urinalysis, the most common lab test we do on people. All right, so those are the 3 tests, the acronyms and abbreviations, the prefixes and suffixes together, and then your root words. And we'll be scheduling those for next week. We want to get the chapter 1 and 2 tests done, and then we'll worry about what days we're going to do these. All right. So now let's go to the PowerPoint for today. Where am I going? Right here. There we go. Which is chapter 2. The body in health and disease. A lot of red in this one. Most of this next test is going to be in chapter 2. There'll be a few test questions from chapter 1. You've already got those from that PowerPoint. Most of this test will be over terms in chapter 2. A lot of terms in here we're going to be talking about. And we do want to try to, I want to try to finish up about an hour early today to give you a chance to work on flashcards and take the tests if you are the infection control test if you already have it. Okay. All right, so anyway, the body in health. Let me orient you with the textbook and what pages we're on and what parts we're actually looking at. That's it right there. Okay. Did anybody try opening the electronic textbook I sent you yesterday? If you did and it wouldn't open, try opening it again tomorrow or today. Did it not open? Did y'all get a chance? Did it open for you?
Mine's opened.
Okay. Jaime, did you try it?
Sir, I'm waiting on my laptop to get here. It should be here today or tomorrow before I download it because my phone is already kind of losing space. So I really haven't opened it yet. So I'll let you know, sir, as soon as I open it, though.
Okay, no problem. It sounds like it's opening. So if not, try it again today. The cloud was all jacked up yesterday. I don't know what was going on. It wouldn't let me upload the class video from yesterday. So I was wondering if the midterm book was open. But it's working today, so I shouldn't have any problems getting today's video to y'all. All right, so, and the other thing that I actually wanted to mention today, now that I think about it, and it's something that Jaime said, was that the Canvas that they're talking about, everybody using and and making this big deal about right now, is that it will not, Canvas will not let you upload any type of thing from your phone. So now we're being told, and that's kind of thing we were talking about, one of the things we were talking about this morning was that not only will Canvas have these other drawbacks, but I would have to have 2 different assignments coming in 2 different ways. Some students uploading their assignments right into Canvas and other students sending them through email. And to me, it's just like, really? Why not just continue doing what I'm doing? Okay. Everybody send through email and we're good. And you'll have to have a computer or a tablet, and the assignments will have to be typed into a Word document. So you'll have to have Microsoft Word in order to send me a homework assignment. And who the hell wants to go out and pay for it if you don't already have it? The stuff I send you, you can open with the free version. But if you're going to type your homework into Word or PDF, you have to have those programs. So in order to upload something into Canvas, your homework and stuff, you have to have Microsoft Word. Now, up there in the big campuses where Canvas is popular, guess what they do? Every student gets a laptop. And on that laptop are the student versions of Word, Excel, PowerPoint, the whole 9 yards already on the laptop. So that's the big schools and why Canvas is so popular with them. For us, we don't have people running out and buying Word just so that they can upload the programs. Word is about $65 a month or $69 a year. And who the hell wants to pay that if they don't have it? So anyway, that's another reason that I probably won't be doing a whole lot with Canvas. But anyway, so the body in health and disease. What we're going to be talking about, obviously, from the chapter is medical terms that we use to talk about the body when it's in a state of health, and then terms we use to discuss the human body and describe diseases in people. So we're going to start with the body in health. And a word, oh, that appears, oh, it's down a little bit further. I don't know why this word wasn't higher up in there. Oh, it's later on. Okay, so anyway, we're going to start talking about the body planes. And you see how it goes. The body planes, cavities, quadrants, and anatomy and physiology, systems and specialties. So we're going to start with the body planes and directions. A plane is an imaginary line or flat surface. If you remember from your, and this is what page? Page 36. If you remember from your geometry classes back in the day, a flat line is a 180-degree angle or flat angle, flat line. So that's a plane. And planes can be used to separate the body in different directions. For example, if I asked you to cut this water bottle in half for me, which direction would you cut? Just show me with your hand. What direction would you cut? Some people showing like this. Okay. What about this? Wouldn't this cut it in half too? And what if you were to do it on the side and cut it into front and back halves? So there are 3 ways to cut this water bottle in half. So if I were to say that to you, it wouldn't be clear. I have to tell you which direction I want you to cut. And that's where the planes come in. And the first plane is the one we just did, this one right here. You would describe it as separating the thing into upper and lower parts. So you'd be cutting like this, so that when you're done, you have upper and lower parts. Straight across. That type of plane is called transverse. A transverse plane. So if you were with me last module, when we did the digestive system, you might remember that section that comes across, the colon comes up and then across. That area that comes across right there is called the transverse colon, because it comes across like that. In the last week, when we do the muscles, we'll be talking about the transverse abdominis, the muscle that comes across like this, across the body. So transverse, when you use that type of plane, it separates into upper and lower parts. How would we use that knowledge in healthcare? Well, the doctor might say, Mahone, listen, go and send them over to x-ray and tell them that I want to see this patient's liver in a transverse view. What is the doctor telling them? We want to see the person's liver as if you've cut the liver like that. And now the doctor can look up into the upper part or down into the lower part, a transverse view. So that's how we would use these terms to communicate to other people how we want to see something. Okay. And let's go on to the net and let's find a picture of something. Let's do, let's just type this. Transverse x-ray. And that's a transverse view right there. See how it's cutting across the person's body? And we're looking either down into the lower part or up into the upper part of their body, okay, by cutting them like this. And it's like now you can take the top part off and look in it, or you can look down into the lower part. We're viewing this in a transverse view. All right, so that's a transverse plane separating into upper and lower parts. Now the next plane is going to go the other direction, and we're going to cut this way now, as if this person is looking directly at us. And when we're done cutting, we're going to have a right and left sides. And notice that on here, right and left is opposite of your right and left right now. It's always going to be the patient's right or left. So don't make that mistake. When you're looking at somebody, this is my right hand, but their right hand is over there. And their left hand is over there. So they're opposite me. I've seen doctors make that mistake. Yeah, Mahone, let's go and put a cast on their left leg. Doc, that's the right leg. Okay, yeah, you know what I mean. Okay. So it's always the patient's right or left. And that would be called a sagittal plane, separating into right and left parts. And of course, on the slides, it has it there for you. Transverse, upper and lower, sagittal, right and left. Now, a sagittal plane can happen anywhere, just like a transverse can happen anywhere you want to do it along the body. A sagittal plane can also occur anywhere along the long axis of the body. So you can do a sagittal section right here. As long as when you're done, there's left and right parts, it's sagittal. But if you want it right down the middle, you're going to call it mid-sagittal. And that's going to give you equal right and left parts and the circles. Okay, why did I circle those? Because we usually do that. In healthcare, when you're documenting something, if you do R with a circle around it, that means right. Or L with a circle around it means left, right and left. So a sagittal plane cuts into right and left parts. If you want equal right and left, you're going to call it mid-sagittal. And I know that's a test question. Name the plane that separates into equal right and left parts. Mid-sagittal. All right, so that's our sagittal and mid-sagittal plane and the difference between the two. Sagittal is right or left, anywhere along the long axis. If you want it in the right and left sides to be the same size, mid-sagittal, equal right and left. Now, in the third plane, we're going to have our patient facing this direction. And you're going to separate them into front and back parts. So it's like pulling off the front part so that you can see inside their body, if you will. And we'll call that that's called coronal plane. Another name for it is frontal plane. And this one is the most common, frontal. Doc say, Mom, let's see their lungs in a frontal view. Then we want to see it as if you pull off the front tissue and then you look right at their lungs, a frontal view. There's one right there. A frontal view. You're looking right into the front of them. So it's a coronal plane, also called a frontal plane.
Mr. Mahone, why are there
Yes.
so many names for one thing?
So many names for one thing, what?
Like through the whole medical language, there's so many different names for one or two words.
Greek and Latin. Why nephro and renal, both meaning kidney. One is Greek and one's Latin. And we really can't make up our mind which one we want to use. So anyway, When I mean, like, why is there so many medical word cause? But then I see what you mean now. Why do we have so many terms that mean the same thing as something else? Okay. Usually because they're, but one's Greek and one's Latin. All right, so transverse plane, sagittal, mid-sagittal, and coronal planes, separating into all these different parts for us. And know how to get through this part on the test is know the second part right there as well. Transverse plane separates into upper and lower. Sagittal to right and left. Mid-sagittal, get that word equal in there. So associate equal with mid. Mid is equal. Mid-sagittal, equal right or left, and then coronal into front and back parts. Our directional terms. You see all that red, man. Boy, y'all gonna get a headache studying for this one. All right, because it's all there. All right, anterior means towards the front. And here we go again, Jennifer. Another word for anterior is ventral. Mean the same thing. There's one of the Star Wars movies. The guy goes, yeah, we're under attack. They're coming to get us. And the other guy goes, okay, I will get on the ventral gun. Where's that gun located on the ship? On the front. Ventral, towards the front. And a synonym to anterior is posterior, towards the back. And another word, or excuse me, an antonym to posterior, that's the opposite. So an antonym is the opposite. A synonym means the same thing. So posterior is an antonym to anterior, it's the opposite. And a synonym for posterior is dorsal, on the back. You can remember that with the idea that all those sea creatures, dolphins, whales, sharks, if they have a fin on their back, that fin is called their dorsal fin, but it's on their back. Why does this keep happening, y'all? As we go through class, I start seeing less and less names over there. I'm looking over here at this thing. See, I was down to 14 now. And remember, I'm one of them. So there are 13 students in class right now. When we started, it was like 18. So this just keeps going down during the day. And I do pay attention to that. And those folks who are checking out, I'll give you a few minutes. Maybe something happened with your phone and you check back in. But if not, I got to mark you absent for the hours you're not sitting here. All right, so anterior is towards the front, posterior towards the back, synonyms being ventral and dorsal. Superior, above, and inferior, below. So superior to something. For example, your eyebrow is superior to the eye. Your mouth is inferior to your nose. Up or below, above or below. Exterior is outside, like an exterior decorator. And interior is inside. I meant to say interior decorator, but that's what I would call myself if I was like a groundskeeper, if I had like a groundskeeping business, cutting grass and that type of stuff. I'd call myself an exterior decorator and then charge a little bit more money for that rather than a groundskeeper or lawn service. I'm an exterior decorator. Pay me a little bit more. Get jobs out at the Dominion and things, because you know that's what they'll do. They'll go in the phone book and go, oh, look, this guy is a grass cutter, lawn care. This guy over here is an exterior decorator. Let's call him and pay a little bit more money for it. But anyway, interior is inside, exterior is outside. Some terms that these are terms that most people are familiar with. Front, back, above, below, inside, or outside. So these terms might be new to you. Medial, meaning towards the middle. Okay. Your nose is medial to your eyes, towards the middle. Lateral, towards the side. The eyes are lateral to the nose. They're towards the side. The shoulders are lateral to your breastbone, towards the side. If you're a football fan, you know that every now and then the quarterback might toss the ball out to the side to a player, and they call that to lateral. He lateraled the ball out there. If he does it wrong, they'll call it a forward lateral. The ball went forward a little bit. Can't do that. So lateral towards the side. We all will also use these terms to name things. For example, in your thigh, this representing your thigh, your knee, your groin area right there. You have muscle right here, muscle right there, muscle right here. This muscle towards the outside over here is called the vastus lateralis, towards the side. This one is the vastus medialis, towards the middle. And the one down the center, the vastus centralis. Lateral towards the side, medial towards the middle. This is where we give baby shots, out there in the vastus lateralis, the lateral muscle of the thigh. Cephal means towards the head, as in cephalic, towards the head. And caudal is towards the feet. Now, your textbook has these ancient names in there. Nobody ever uses these two words anymore, but they're in your textbook, so I went on and put them there. They're pronounced cephalad and caudad. We don't use those. We use cephal and caudal now. Cephal towards the head, like encephalitis. Caudal towards the feet, a term we hardly ever use. Either one of these, we hardly ever use those. Now, the words that are more difficult to kind of wrap our head around. Let's use the arm as an example, and let me go to the whiteboard rather than trying to model this out for y'all. So here's your person. And here's the person's arm with the hand right there. Okay. Now, in this position, the hand is inferior to the elbow. The hand is below their elbow, inferior. But if the person puts their arm out this way, the hand is now lateral to the elbow, moving towards the side. But if they raise their arm up, now the hand is superior to the elbow. So you see how the hand went from being inferior to superior depending on the position of the person's arm. And the same thing happens on our legs. So on the extremities, we use the terms distal and proximal, only on the extremities, the arms and legs. So distal means away from point, and this is in the slide, of origin. And the point of origin for the arm is right here, the shoulder. At the leg, it's the hip, the point of origin. So if this thing is away from the point of origin, it's called distal. So in all three positions, the hand is away from the point of origin when we talk about the elbow. So the hand is distal to the elbow in all three positions, moving away from that point right there. So if you're moving away from that point to get to your reference, it's distal to the elbow, being right here. So in all three positions, it's still distal, regardless of the position of the arm. Now, if you want to move towards the point of origin, like that, that's called proximal, to move towards the point of origin. So the elbow is proximal to the hand. If to get to that landmark, you have to move towards the shoulder, in this case, it's proximal. The elbow is proximal to the hand. And you see the elbow is proximal to the hand in all three positions. You get two there, you're moving towards the shoulder. Distal to move away, proximal to move towards the point of attachment or point of origin. And that's what it should have there in your slides for you. Moving towards the point of attachment or origin, or moving away from the point of attachment. Distal and proximal. And those are our main directional terms, and you can expect to see all of them. But still writing intensely. Slow writers. Maybe y'all should get like a keyboard. You can type. If you're a fast typist and writer, so maybe you need a keyboard. All right, so it's in the slides. All right, so our body cavities is the next section we're going to look at. And let's go to the textbook for just a second. Looking at page 41. And you can see three body cavities, one illustrated in green, which contains your brain, contains your brain and spinal cord. One illustrated in purple, which contains all the organs of the chest, the heart, lungs, trachea, esophagus, and thymus gland. I'll list all those out for you on the slides. And the third body cavity down there, containing all of your abdominal organs and your intestines and colon and bladder. So those are the three body cavities. And now let's look at their names. We'll start with the dorsal cavity, which is on the back. And it contains two parts. And those are your cranial and spinal cavities. So the dorsal cavity has these two parts, cranial and spinal. The cranial cavity contains the brain. The spinal cavity contains the spinal cord. So a sample test question for this might be, name the two parts of the dorsal cavity. They're the cranial and spinal cavities. Or name the organs located in the dorsal cavity, the brain and spinal cord. Now, people don't understand how much our organs move around inside our bodies. Okay? We tend to think of our organs as being just in a fixed position inside us. They don't move a lot, but they do move slightly inside their cavities. As a result of that, we have membranes of these cavities that help protect the organs inside there as they move around. And the membranes of the dorsal cavity are called meninges. Y'all have heard of those before, as in that condition, meningitis. And now you see how dangerous meningitis can be. It's the membrane around your brain and spinal cord. If that thing inflames, it's going to squeeze the brain or squeeze the spinal cord, your meninges. You see, the meninges have three layers. I don't ask the test question about these, but I do ask this right here. Name the membranes of the dorsal cavity. They're called meninges. Now the meninges have 3 layers there. We discussed those when we do the brain and spinal cord as part of the lessons, and we'll be doing those next module for my new students. We'll talk about the 3 layers of the meninges: the dura mater, the arachnoid membrane, and the pia mater. So I'm going to go on and change that to black. What you can do in your notes, if you are writing on this, is you can go ahead and X through that or whatever to make sure you don't get into studying that. We'll get that on the test later on. So from here, you should know that the membranes of the dorsal cavity are called the meninges. The 2 sections of the dorsal cavity, the cranial and spinal cavity, and the organs located in there are the brain and spinal cord. And the meninges are the membranes that protect the membranes of the dorsal cavity. Now the ventral cavity is the front part. You see it in the text as the purple and blue together are known as the ventral cavity. So had the dorsal cavity in green, the ventral cavity, the 2 parts in the front. So the ventral cavity contains the thoracic, abdominal, and pelvic cavity, those 3 parts. Thoracic, abdominal, and pelvic. You see them there. Thoracic, abdominal, and pelvic, the 3 parts of the ventral cavity. Because we use the word ventral, we know that this cavity is on the front of the body. Dorsal cavity on the back, ventral cavity on the front. Some people refer to the abdominal and pelvic cavity together. That's why here it's all one little section. And you see they've labeled the upper part as abdominal and the lower part as pelvic. But if you refer to them together, like the color implies, then you would call it abdominopelvic. You just put the 2 words together. The abdominopelvic cavity. So either way, you refer to them separately or you refer to them together. Doesn't really matter. All right. So those are the sections of the ventral cavity: the thoracic cavity, abdominal, and the pelvic cavity. And we'll talk about each one separately. The thoracic cavity contains the heart, lungs, trachea, esophagus, and thymus gland. Sample test question: which of the following organs is not located in the thoracic cavity? And you'll have something there like liver or something like that. Heart, lungs, trachea, esophagus, and thymus gland. Now, there are a couple of different membranes of the thoracic cavity, because the heart and lungs have to have membranes completely around them. Because when you look at those organs in their position, the right lung, the left lung has a notch in it like that. And your heart sits right in that notch. So these organs are so closely located together that they have to have membranes around them to protect them from rubbing against the other organs. So the heart has its membranes, and then the lungs have their protective membrane. And those membranes help to keep these organs from rubbing against each other. So the membranes around our heart are called the pericardial, around the heart. Pericardial membranes. the membranes of the heart. And you see the parts right there. I won't spend any time going through those because we will do them when we do the heart, next module. So the pericardial membranes are the membranes around the heart. And the other ones, the pleural membranes, the membranes around the lungs. So those are your 3 test questions from the thoracic cavity. Number 1, which of the following is not an organ of the thoracic cavity? And you'll see liver or spleen or something like that in the list. Number 2, the membranes around the heart and the membranes around the lungs. The pleural membranes, because pleuro means lungs, the pleural membranes. That's your thoracic cavity. The organs located in there and the 2 sets of membranes, pericardial and pleural. Now, all this is over here. I'm going to go to the whiteboard and try and make sense of all of this right here. And that's your abdominal cavity. If you think of this as the person's belly button, the abdominal cavity is separated into 4 sections that we call quadrants. In your textbook, that's right there, page 42. The 4 abdominal quadrants, 1, 2, 3, 4. They're labeled as this is the person's right side, and this is their left side. Remember, it's as they're looking at you. So this quadrant right over here is the right upper quadrant. Let me spell that word, Q-U-A-D-R-A-N-T, quadrant. The right upper quadrant and the right lower quadrant. And on this side, the left upper quadrant and the left lower quadrant. It's important that you know the quadrants because name the organs located in the upper right quadrant. So you have to know where they are, upper right, upper left, lower right, and lower left. So if you have to be able to imagine them on yourself. Upper right, upper left, lower right, lower left. And you should be able to put your hand right here and say what organs are right there in the upper right quadrant. You're going to find your liver and gallbladder. So if I do this, liver, gallbladder, upper right, upper left, right here, your stomach and spleen. Liver, gallbladder, stomach, spleen, upper right, upper left. Lower right, lower left. Lower right, you're going to find your colon, intestine, and appendix. The lower right. And in the lower left, colon and intestine. And right in the middle, it's actually in all 4 quadrants, is your pancreas. So that's what that slide is saying in text. Right upper quadrant, liver and gallbladder. Left upper quadrant, stomach and spleen. Right lower quadrant, colon, intestine, and appendix. In the left lower quadrant, the colon and intestine. And the pancreas sits in all four. And that's what you're seeing in that slide. And it should be lower left, intestine, and colon. And the pancreas in all four. Left intestine. Anyway. Oh, come on, really? Jesus. Thank you. And then pancreas and all four. All right. And just like the other cavities, there are membranes that protect the abdominal cavity, and they're called your peritoneal membranes. The membranes of the abdominal cavity. Peritoneal. You say the word again. Peritoneal membranes. It's killing me, y'all. Oh, man, I need to take a nap when I finish today. I'm going to sleep. Yeah. All right. So those are, unless my wife comes home early, she's been coming home early. She likes to do that when I'm at home, so she can just come home and be home because I'm at home. Get on my damn nerves. Just coming home because I'm here. So know those, the organs located in each quadrant, and then the name of the membranes that protect all those organs, the peritoneals. The pelvic cavity contains the urinary bladder and the organs of reproduction.
Sir, can you go back real quick, please?
Why you want me to go back?
Because I write slow.
Jeez. All right, like old people. You know what? Let's go ahead and take a 15-minute break. Come back at 1:45. It's a good time to do this. Come back at 1:45. Yeah, a little bit bigger. All right. Ugh. Okay. So how would we use this information out there in our practice? Okay. Somebody comes in and tells you at the front desk that they have a sharp pain in their upper right quadrant. Or they go, I had a sharp pain right here. Oh, since the liver doesn't have sharp pains like that, that's a gallbladder. They got gallstones. If the doctor says, well, this patient has upper right quadrant distension, in other words, when the doctor does that tapping on their upper right, y'all have them do that? They do this right here. And they tap on the 4 quadrants. Doctor's tapping over here and they're feeling distension right there. That's their liver. They got liver cirrhosis. If the doctor says, well, the patient has upper or left upper quadrant distension, that's their stomach. They've got gas or they've got an enlarged spleen. Right quadrant pain, upset stomach, severe pain, problem with their spleen. Okay. They have a difficult or a painful sensation right below their belly button. That's their pancreas. So this is how you are conversationally keeping up with your doctor as well. Doc says, well, this patient's got left upper quadrant pain. Ooh. The doctor's either going to want an x-ray of their stomach or an ultrasound of their spleen. Over here, sharp pain in the upper right quadrant, they want to do an ultrasound of their gallbladder. Lower right quadrant pain, that's their appendix. So knowing where these organs are can help you keep up conversationally with not only with the person you're checking into the clinic, but what tests the doctor is probably going to be walking out that room asking for. Upper right quadrant pain, oh, doctors don't want to do an ultrasound of their gallbladder. Let me go on and start the paperwork or whatever. And that's the thing that makes us valuable. When the doc walks out and says, Mahone, let's go on and schedule them for a gallbladder ultrasound. Already got the paperwork ready, doc. Oh, thank you. You just cut 10 minutes off of my day. Thank you very much. That's what makes us valuable in a clinic. Okay. Being able to anticipate what the doctor's going to ask for. And part of that is knowing this kind of stuff. All right. So that's how we can use this information out there in our practice, just knowing where the organs are inside the abdomen. So we can anticipate what tests and things the doctors might be asking for based on the patient's symptoms. And then the peritoneal membranes are the membranes that support those organs. In the pelvic cavity, the urinary bladder, and the organs of reproduction. The membranes in there are called the omentum. Say it again, omentum, just like it's spelled. Cells, tissues, and membranes. I have this as the levels of organization of the human body. Levels of organization. And the simplest representation of life are the chemicals and minerals that make us up. Chemicals like what we make our hormones out of, potassium, sodium, and so on. And then minerals like calcium, iron, and even a little bit of gold inside the human body. We get it from the water we drink. Okay. So all these chemicals and minerals coming together to create what would the smallest living part of us is our cells. Cells are made of all these different chemicals and minerals coming together at the right time, in the right amount, under the right circumstances. And they create cells for us. That's a living organism. So cells are the smallest living part of us. Okay. There are over 300 different types of cells that make up the human body. We tend to think of cells as, let me just do a new one. We tend to think of cells as this thing right here. With that nucleus in the middle. But some of our cells are actually square. Some of them are really tall and elongated. Some of them are really long and flat. Some of our cells can propel themselves. There's only one cell in the body that can do that. And some of our cells just look kind of strange, like they'd be more at home in a sci-fi movie than in our body. With the nucleus in the middle. We call it nerve cells. So we have over 300 different types of cells in our body, okay, that come together to make the human organism. Or cells come together in clumps. When you take a clump of cells together, that's what we call tissue. Tissue is anything that contains living cells. So you take a bunch of skin cells together, that's tissue. We have 3 categories of tissue: soft tissue, the stuff we think about, our skin and our organs; hard tissue, our bones and our teeth. Bones contain living cells. That's why if you break a bone, it grows back together. Bones are living. And then liquid tissue, our blood contains living cells. So blood is liquid tissue. So anytime we get a group of cells together to perform a function, we call that stuff tissue. And 3 categories of tissue: soft, hard, and liquid tissue. Anything containing living cells. When we take a clump of, or 2 different type, or a couple different types of tissue, bring that together, that creates organs for us. That's why it's so hard to clone an organ, because organs are made out of more than one type of tissue. Our heart has 3 different types of tissue: the outer tissue, the muscular tissue, and the inner tissue. And having all 3 types of tissue come together in just the right amount in the right places is very difficult to do. So we can't clone organs because they're made of more than one type of tissue. But we can clone, for example, the liver. Does anybody know why we can clone the liver? Listen to what I just say about being hard to clone organs, because they're made out of different types of tissue. So why would the liver then be easy to clone? It's just one type of tissue. The liver is what we refer to as being homogeneous. It's made out of just one type of tissue, all the way through. So there's no outer, inner, and then middle tissue of the liver. The liver is the same thing all the way through, one type of tissue. So it's homogeneous. And it's one of the organs that we can actually clone.
I'm telling you, that liver tissue is really nice.
You may out there in the world hear of people cloning skin, but when they clone skin, they're only cloning the outer layer, the epidermis. The epidermis is one type of tissue. If they try to clone all 3 layers of the skin, they won't be able to do that. Too much tissue, or too many different types of tissue. Now, when you take a bunch of tissue, clump it together to make organs. And when we do the endocrine system next week, or a week after next, we'll be talking about the difference between organs and glands and what glands are. But more than one type of tissue coming together creates organs. Now, we can take a bunch of organs and group them together. For example, the mouth, the teeth, the tongue, the esophagus, stomach, intestines, colon, rectum, anus, liver, gallbladder, and pancreas all come together to create the digestive system. Our heart and all the blood vessels come together to create the circulatory system. So organs group together to create organ systems. And the typical organ systems would be like your respiratory system, nervous system, uh, reproductive system, urinary system. There's groups of organs working together to carry out a function. That would be an organ system. So when we group organs together like that, that's where we get the organ system. And you can see the organ systems of the body through the next few pages after the cellular part. Going into gastrointestinal system, respiratory system, cardiovascular system, the blood system, the integumentary system, and so on. All these different systems, a combination, and they show on the next side what organs are part of that system. The bones, cartilage, ligaments, and joints are part of the skeletal system, and so on. So it lists out all the systems of the body and the structures associated with those. I don't ask any questions on this because this is how we'll progress through the human body. And next module, and some of y'all remember some of these systems, or most of them. We've already done with some of y'all the gastrointestinal system, the respiratory system, the cardiovascular system. And for my new students, this is what we'll be doing next module. We'll be going system by system through the human body and testing on all of these systems. So I'm not going to talk about any of those right now because you've got it all coming. This module will be doing the endocrine system in the last week, the endocrine, muscles, and skeletal in the last week. All right. So that brings us to the end of the body in health. You see, we're going all through, The homework pages start right there. They continue towards the end. Y'all, if you've looked, you've seen that the chapter 2 homework is in 2 sections. Page this through that and page this through that. So it's in 2 sections for this chapter. Go through all these homework pages and then the body in disease. Page 64. And that's where we're going in the slides as well. Disease categories. I didn't mention this, so let me do it now. The simplest level of organization for us is the chemical level. The highest level of organization is the organism. That's why those are in red. Simplest level, the highest level, or the most complicated level. Chemicals and minerals, and the organism is the highest level of organization. Yes, I do that kind of stuff sometimes. Okay, so that's that. You know, I got mad at my wife yesterday, y'all. I mean, I got mad. We went to the Walmart to pick up some stuff to make for dinner or whatever. And I asked, I said, babe, do you think that if we met today, if we never met before and we were just meeting today, do you think we would fall in love like we did when we was young? And you know what she said? No. That hurt my feelings, man. I was like, I know you didn't just. You know, I was mad. I was walking around Walmart with an attitude. Now, I know you didn't just say you wouldn't fall in love with me today, you heifer. Anyway, get on my damn nerves. No. And it didn't even pause, just no. Like she didn't even have to think about it. No, I wouldn't like, I'm like, you punk. Anyway, hurt my feelings. Anyway, so disease categories. How we describe or talk about disease in people. I'm going to look at the next couple slides because I'm wondering why something is missing. why isn't it here? So let me go on and put it. Da-da-da. The Body and Disease, we'll title this one. And two words that are two things I want to talk about. I want to talk about preventive medicine and the term etiology. You see them both right here. Page 64. Preventive medicine and etiology. All right. So what do these terms mean and why do I want to talk about them? The preventive medicine should be the focus of all healthcare today. To prevent these things from happening in people. Because it's going to be a hell of a lot cheaper to pay for your mammograms more often than it will be to pay for your breast cancer. So preventive medicine is just the way to go. And insurance companies understand that. So if you have a history of breast cancer in your family and you talk to your insurance agent, then they're going to recommend that you have mammograms more than every 2 years or more often than every 2 years. Well, we want you to have a mammogram every year and we'll pay for it. Because if we catch that cancer early, it's going to be a hell of a lot cheaper for us. So preventive medicine is the way to go. Talking about how to keep people from getting sick rather than trying to treat them when they do get sick. Preventing the stuff from happening in the first place. And a lot of treatments and medical advertisements and things like that today are all geared at preventive medicine, stopping it from happening in the first place. Anybody watch Channel 5 News? They have a section called Wear the Gown. And they talk about all these preventive medicine tests and things like that that people should be having to keep from getting the stuff in the first place. I just had my colonoscopy. Maybe it's been like 1.5 years, almost 2 years now, to look for colon cancer. They didn't find any, but they found 5 polyps. So they recommended I'm going to have my colonoscopy every 3 years instead of every 5 years. Colon cancer is so detectable and therefore preventable. There's no reason anybody should be getting colon cancer if they're doing their colonoscopies like the doctors recommend. And in my case, since they found those polyps, every 3 years. That's preventive medicine. And doing that every 3 years is going to be a hell of a lot cheaper than treating me for colon cancer. The second word there is one that I mentioned yesterday when I said that there'll be a word that will be real similar to one I gave you yesterday. Yesterday, the word I gave you was etymology. The study of, etymology, the study of word origins. The word we're using today is etiology, and the definition is very close. The study of disease origins. Where does a particular disease come from? And in here, we're not saying where does or where did you get HIV? No, here we're saying, or how do you get HIV? Here we're saying, where did HIV come from? What causes it? Caused by a virus? Is it caused by a bacteria? So we're not saying how you got it. We're saying, where does the disease come from? What causes the disease in people? We know you can get HIV through sex, so that's not etiology. HIV is caused by a virus that gets into your blood, invades your cells. That's the etiology of HIV. So where does the disease come from? The study of disease origins. And you will see that on your test. That's why I'm surprised I didn't have it in there already. Maybe it's down there lower and I just didn't go far enough. So etiology, the study of disease origins. Don't confuse it with etymology, which will also be on your test, the study of word origins. I'll say that. So that's something you really do want to have down in your notes, because I don't know if it's anywhere else in the slides. Etiology, the study of disease origins. All right, some of these words that y'all be using, and you know what, we need to get going because there's something else we need to talk about today. Oh, and there are only 14 people in class. Oh, cool. All right. All right, so anyway, some words, these words will appear in your textbook in the upcoming pages. You see them right below under disease categories. Again, down on page 64, starting with the term congenital. And they have a bad definition here. What I mean by bad is that they have two conditions listed in one group. And you can see here two different definitions. Congenital, caused by abnormality in the fetus as it develops bone, or caused by an abnormal process that occurs during gestation or birth. So they have two definitions here. And the truth of the matter is, this is the correct definition. Caused by an abnormal process that occurs during gestation or birth. This first definition, they've actually got the word in there. As the fetus develops. That's called a developmental disorder. If it happens while the fetus is forming inside you, that's called developmental. But if it happens while the baby's being born, that's called congenital. I think the two should still be separated. This textbook tries to loop them together. Why? Because they want to put cleft lip and cleft palate in the same category as cerebral palsy. That does not go, that doesn't work for me. The reason is that when your baby's born with cerebral palsy, by this definition, the doctor can say, oh, it's just one of those things that happens while, like cleft lip, cleft palate. And no, it's not. It's not even close. So I don't like to see, the reason I don't like to see these two definitions clumped together is I don't want to see those conditions clumped together like that. Cleft lip and cleft palate are not the same thing as cerebral palsy. And you can't describe it to a patient that way. When a patient's born, when a kid is born with cerebral palsy, the doctor says, oh, it's just one of those things that happens. No, it's not. It's a bad thing. It happened as a result of a problem that happened while they were being born or a mistake the doctor made. So now you see why a doctor might want to clump those two together to hide a mistake. Cerebral palsy is often caused by abnormal process that occurs during gestation. Doctor dropped the baby. Doctor went to do realized the baby was born breech head, arm or leg rather than head, a butt presentation or something like that. They took too long to get the C-section kit. Doctor tried to turn the baby around and compromised the umbilical cord while they were turning the baby. Doctor pulled the baby out by their arm, damaged the nerves in their arm. See, these are things that are mistakes made by the delivery team. Also causes cerebral palsy. So I don't like to see those two clumped together. All right, so anyway, the next condition is called, but for our learning, developmental, something that happens while they're being made. They develop a third nipple. The heart is made outside the body. And by the way, third nipple is not as common as uncommon as you would think, and is more common in men than women. Men who are born with a third nipple. The heart that develops outside the body. They develop an extra toe or an extra finger. An arm is missing. The roof of the mouth or the upper lip doesn't close the way it's supposed to, cleft lip, cleft palate. If you remember last module when we looked at the spina bifida, the bubble sticking out the back of the baby, out of the baby's back because their vertebrae didn't form correctly. All of those are developmental disorders, things that wasn't made right. As opposed to congenital, those things that happened to them while they were being born. You had a perfect little baby, but during the delivery process, something got broken or something didn't happen right. A problem that happens at birth. So congenital versus developmental. The next category is degenerative. Things just breaking down over time. As you get older, tissue degenerates. I have a condition called degenerative joint disease. The joints between my vertebrae are breaking down. And as a result, I'm getting spinal arthritis. Multiple sclerosis. The protection around their nervous system is breaking down. Loss of hearing, arthritis, macular degeneration. The macula in their eyes are breaking down. So they're going to lose their vision or their clear, sharp vision. So something's just breaking down inside the body, result of getting old. Environmental conditions caused by things we're exposed to in the environment in which we live. Seasonal allergies, skin cancer, if you spend a lot of time out in the sun, or if you live on the equator. Or did y'all hear the other day that in Death Valley, United States, it was 130 degrees. So anyway, something caused by the environment that you live in. Now these two next two are real close, but recognize the difference between genetic and hereditary. A genetic disease is any disease that happens in your genes, whether it's passed from the parents or not. If it is a mistake in the genes that you get from your parents, we call that hereditary. So genetic is any mistake in your genes, whether you get it from your parents or not, or that you don't get from your parents. For example, Down syndrome. Down syndrome is not hereditary. You don't get that from your parents. And two kids with Down syndrome could have a perfectly healthy baby. Or two perfectly healthy parents could have a child with Down syndrome. You don't get it from your parents. It's genetic, but you don't get it from your parents. As opposed to cystic fibrosis, which is also genetic, and you do get from your parents. We call it hereditary. Genetic conditions that come from our parents. Sickle cell, hemophilia, cystic fibrosis are all good examples of that. So know the difference between something being genetic, a problem in the genes, and then hereditary, a problem in the genes that you got from your parents. Now this one down here is pronounced iatrogenic. 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 And they have the correct definition: caused by medication or treatment that was given to the patient. but their examples are way off the mark. Now, again, this is somebody who read a definition, thought they knew what that definition meant, and came up with their own examples. So this person who wrote this have no idea what that definition means, caused by medication or treatment that was given to the patient, because they came up with the way wrong examples, not even close. Iatrogenic is not these mistakes, wrong blood driven, surgery performed on the wrong leg, incompatible blood type. That's not correct. Iatrogenic is caused by the medicine that we give you or the treatment that we perform on you. For example, if we give you radiation therapy for cancer, what's that going to cause to the body? You've seen people who've had chemo or radiation therapy. What happens to them that you can
Lose
see?
their hair.
Their hair falls out. That's iatrogenic, caused by the medicine we gave you, not a mistake like cutting off the wrong leg or some shit. Okay. So again, this is somebody who read the definition and they were absolutely wrong. And that's why reading the textbook does not always teach you. You need somebody to explain these definitions.
Mr. Mahone,
Yes.
I don't know
Yeah.
if it's your internet connection or what, but you're like fading in and out when you're talking.
Am I? Is
Yes,
everybody
sir.
doing that? Are the rest of y'all having me fade in and out? Okay, some people shaking their
Clear,
head.
clear on my end, sir.
Okay, check the volume on your device. It might be the speakers. When the volume goes up a little bit, the speakers start to crack some. So turn the volume down on your device a little bit. And I'll lean back from the microphone a little bit as well. All right, so iatrogenic. If we give you cortisol drugs, that might lead to a condition called Cushing's syndrome. It's iatrogenic. The medication causes Cushing's syndrome in people. Have y'all ever heard on the TV commercial about a drug say, if you develop tremors or unnatural movements, stop taking the medicine because those could become permanent? Iatrogenic. The medication we gave you causes tremors in your hands. So why do we give you the medication then? Because the side effects outweigh the disease itself. Okay. If we don't give you, if we give you lithium drugs, it's going to make you shuffle your feet when you walk. Those are iatrogenic conditions. We know they're going to happen, but the treatment outweighs the disease. Okay. So again, somebody read a definition and they were wrong, came up with the wrong examples. So iatrogenic, caused by a medication or treatment that we perform on the patient. Idiopathic, here you want to think the word idiot, meaning not knowing. I know people use idiot as an insult, but in healthcare, it just means we don't know something about something. I'm an idiot about cars. I know where to put the gas. I used to know how to jumpstart a car until they put the damn battery way down underneath the motor down there. I'm like, damn, how do you get down there? So I'm out there one morning just like squeezing my hand and we finally got it done. And then one day I was doing something else and noticed there's a little jump start pole up there in the upper part of the motor that you're supposed to hook the jumper cables to. I didn't know that shit. I'm an idiot when it comes to cars. So idiopathic, unknown pathology. Patho is disease, having no identifiable or confirmed cause. And they got the wrong example in here. We know what causes SIDS. Back in the 80s, they didn't know, but today we know what causes SIDS in babies. So they've got another wrong example in there. So this is somebody who, when they wrote this chapter, they were going through the dictionary, looking up the definition of each one of these terms and coming up with their own examples. And their examples are not correct. So you see, anybody can write a damn book. It doesn't mean they know what they're talking about. I should write a book. Anyway, so infectious, yeah, I think we know what that means by now. Neoplastic, caused by new growth. Remember we used the word neo was one of our prefixes that meant new. And the example I gave y'all was neoplasm, a new growth. I said we don't like to see new things growing on old people. Nosocomial, that's on your other test, so it's not going to be on this one. Healthcare acquired infection. And then nutritional, this is caused by lack of nutrition. Conditions like what do they have down here? Pernicious anemia. Okay. A better example of that would be rickets. When children don't get enough calcium and their bones are too soft to hold their body weight and they end up with severely bowed legs. They have rickets. I mean, goes way beyond what we think of as bowed legs. These things are severely bowed out. So much so that the kids are sometimes walking on the side of their feet. Their legs are so curved. Comes around and boom, they're actually standing on the side of their foot. They have rickets because they didn't get enough calcium. If ladies don't get enough iron in their diet, and I say ladies because y'all are more common, you develop anemia. So cause lack of nutritious food, insufficient amounts of food, or an inability to utilize them. Diabetes should be in this category, nutritional disorder. They can't absorb sugar. All right, the next section. Onset, course, or outcome of disease. A couple words in here that are important for y'all. Symptom and sign. You have heard these words before. What are the signs and symptoms? So what are they? A sign is something you can see. Just like the name implies, you can read it, a sign. A symptom is a sensation. They're going to have to tell you about that. So a sign would be, well, let me ask y'all this. A bloody nose, would that be a sign or a symptom?
Symptom.
A sign. Why? You can see it. Anything you can see is a sign. What about upset stomach? Is that a sign or a symptom?
Symptom.
It's a symptom. You can't see an upset stomach. What about vomiting? Anybody vomiting?
Sign.
Vomiting is a sign. You can see them doing it. What about dizziness?
Symptom.
Is a symptom. But what if they're unsteady?
It's a sign.
That's a sign. So of a condition or the state of vertigo, dizziness is the sign, unsteadiness, or dizziness is the symptom, unsteadiness is the sign. If you can see it, it's a sign. So if they say they have upset stomach, that's a symptom. If they're doing like this, ooh, that's a sign, something I can see. And we would describe that as guarding. So a sign versus a symptom, something you can see versus something that they're feeling. If they're feeling it, it's a symptom. What about fever? Is a fever a sign or a symptom?
Symptom.
It's both.
Symptom. It could be both, probably.
A sign. How do we know they have a fever? We check their
Thermometer.
temperature. Once we check their temperature, boom. Oh, look, they have a fever. It's a sign, something we can see. We just measure it that way. So signs versus symptoms. If a person is asymptomatic, like they're referring to with some folks in the coronavirus, some people are asymptomatic. They're not showing any symptoms, or they're not having any symptoms. And then a syndrome is a set of signs or symptoms associated with a particular disease. Have y'all ever seen somebody with Down syndrome? How many of y'all have seen somebody with Down syndrome? Okay. What was it about them that let you know they have Down syndrome? Something that you could see.
Their facial appearance.
Their face is puffy. Their hands are puffy. Makes their eyes look smaller because their face is puffy. They're absent a couple of creases across the palm of their hand because their hands are puffy. Their tongue tends to be puffy as well. They sometimes don't have this little dip underneath your nose that everybody has because their face is puffy. Theirs is out flat, and you don't see that on them. So since all of this happens in everybody that has Down syndrome, then we call it a syndrome, because everybody that gets this will have the same signs or symptoms. So a set of signs or symptoms associated with a particular disease like Down syndrome or acquired immune deficiency syndrome or AIDS. We're going to see a decrease in white cells in all of those people. So a set of signs or symptoms associated with a particular disease, that's why we call it a syndrome, or we put that name, that word on there. Course or outcome, a disease can be acute. It can come on suddenly. Now, when we say acute, I need to remind y'all of this. This word is not talking about Mr. Mahone. Get it? Yeah, okay, somebody got a sense of humor. All right. Oh, he's so acute. He's so acute. Yes, he is. All right, so anyway, acute means it came on suddenly, like acute liver failure. Liver failure that happens in just a few days or weeks, as opposed to chronic, which takes years, sometimes decades, for the disease to be a problem for you. Hepatitis B causes chronic liver failure. But if you take an entire bottle of Tylenol, that could cause acute liver failure. It can cause your liver to shut down right now or within the next couple of days. So acute versus chronic, it came on suddenly within a few days or weeks, versus chronic, it takes years for it to actually cause a problem for you. I don't know where they came up with this 3 months from. I don't know. I just don't trust the author of this chapter. But anyway, they came up with an actual number, 3 months, if you say so. Okay. So acute is sudden onset. Chronic is over time. An exacerbation, pronounced exacerbation, a sudden worsening of the signs and symptoms. In other words, they just get worse all of a sudden. Versus remission, a sudden lessening of the signs or symptoms. Your liver can be, your cancer can be in remission. Doesn't mean it's been cured, but your tumor isn't growing any bigger. It's in remission. There was one young lady that joined the Air Force. My wife's job over at Lackland is to process people out of the military for medical reasons. So she does all their paperwork, all those basic trainees that come in, and we find out that they're actually sick. She processes all of them out of basic training. One young lady came in with cancer, and my wife had to process her out of the military. Now, she had not done maybe, I don't know, I think she'd done like 3 weeks of basic training.
Wow.
And got sick. They sent her over to the hospital, and they said she had cervical cancer. Now, her lawyer, her family afforded a lawyer, and that lawyer argued that, yes, she did have cancer when she came into service. However, the basic training exacerbated her cancer. and made it worse. And guess what? They won the case. And she was discharged from the Air Force with full benefits, full medical benefits, even though she'd only been in for 3 weeks. Her lawyer was, when she came in, the cancer was in remission. During basic training, it was exacerbated because of all the stress of basic training. And it's true. The stress of basic training breaks people sometimes, even Air Force basic training, which is the. So anyway, know those 2 terms. Exacerbation, it gets suddenly, it gets worse suddenly. A remission, it gets improved, but there hasn't been a cure. You still have cancer. You want to hear your doctor say you are cancer free, not that your cancer is in remission. You still have the cancer. It's just not growing. So exacerbation versus acute versus chronic, exacerbation and remission. A sequela. This is also one of your test questions, a sequela. A sequela is an abnormal condition or complication that arises because of an original disease and then remains after the original disease has resolved. What does all that mean? Okay. You have a condition in you, and we'll call that condition pregnancy. So you get pregnant. During your pregnancy, you develop gestational diabetes. After you have the baby, the pregnancy is over, but you remain gestational diabetic or type 2 diabetic. So this happened because of that. When this goes away, that remains. A condition that arises because of a original disease or condition and then remains after the original condition is resolved. You get pregnant, you develop gestational diabetes. After the pregnancy is over, the diabetes remains. It stays. It's a sequela. All right. Definitely on your test. And then we're going to skip down to prognosis. This is the physician's assessment or prediction of the outcome of your disease. In other words, are you going to survive this thing? Remember, it's just a prediction or an educated guess based on previous cases. So what is the prognosis for a 85-year-old female with coronavirus? What do you think the doctor's prognosis might be? Good, fair, or poor? Is this lady going to survive this thing? Good, fair, or poor? What do you think? 85 years old, coronavirus.
Poor.
Poor. What about 15-year-old person with coronavirus? Good. As opposed to a 45-year-old. Fair. Good, fair, poor. What do you think the prognosis would be for HIV infection today? Are you infected with HIV today? Is it going to kill you? Fair. Remember, people are living decades with HIV today. It could, but if you do everything we advise, fair prognosis. We wouldn't say good, but fair. Yeah, you'll probably live a while. What do you think the prognosis is for stage 4 stage 4 lung cancer? Poor. Y'all know that stage 4 is not what you want to hear. Okay. Yeah, you've got or stage 4, or also referred to as end stage. You have end-stage liver failure. Ooh, damn. Or you have end-stage congestive heart failure. Oh, yeah, that's going to kill you. So that's a prognosis, good, fair, or poor. The doctor's prediction of whether you're going to survive this thing or not. All right. And the last couple terms in this section, not on your test, but worth talking about, is the disability and the terminal illness. Now, disability. First of all, don't fall into the trap that everybody falls in with this word. Okay. Can you see everybody's disabilities? No. So if you see somebody parking the disabled parking, get out of their car and walk into the Walmart, don't get up bent all out of shape. Oh, look, you're not disabled. Disabled does not always involve walking. And plus, the person might walk right in the store, get them one of those little carts and ride around in the store. Why? Because they have COPD and they can't walk more than a couple 100 feet. So just because you can't see the disability doesn't mean that person isn't disabled. I am 80% disabled. Can you see that on me? No. So don't fall into that trap, guys. Just because somebody doesn't fit that definition of walking on crutches and canes and in wheelchairs doesn't mean they're not disabled. Okay. And then terminal illness. Anybody think y'all might like to work with these folks over at hospice? People who know they're dying. It takes a special person to work with this group. Okay. My very first job in the Air Force was on the medicine ward. See, hospice is just something that's been around since the 90s. Before then, you went to the hospital to die. And where did you go? To the medicine wards. And I was male medicine. Everybody up there was dying from something. Most of them from the different cancers. That's why I've seen cancer of every part of the body, including cancer of the roof of the mouth, cancer of the penis. Did y'all know you could even get that? Rectal cancers, anal cancers, I've seen them all. Okay. All them people coming up there dying from cancers. And that takes a special person to work those environments. I was there for just 2 years on that ward, but I hated it up there the whole time, y'all. I didn't hate caring for the patients. I hated the mental toll that it takes on you. I actually enjoyed the patients a lot, but it does take a mental toll on you. You go home one night, come back the next day, and the bed is empty, or there's another person in the bed. You tend to form bonds with these people. Some of these folks will be in these places for 6-7 months. How can you avoid forming a bond with these folks? And then suddenly they're gone. And there's another person in the bed. Damn, Mr. So-and-so gone. So anyway, it does take a special person to work in the hospice environment. So you might be that one. All right. So all of those terms, as you can see in the slide, or the ones that you will see on your test, or they're in your slide for you. And sequela, being the longest definition of all, should be easy to pick out for you. It was like, oh shit, that's sequela. Look at all them damn words. But look at that definition. You know that's a sequela. All right. So sign, exacerbation, sequela, and prognosis. Now you will see all 4 physical examination techniques. Inspection, and they are the last page of this chapter. Physical exams, and the 4 words right there, and then pictures representing each. The inspection is examination by looking at the thing. You're going to inspect When we look in the eardrum or in the ear and look at the eardrum, we expect the eardrum to be gray or silver in color. If it's red or pink, it's an ear infection. So right there, the doctor is inspecting the eardrum, just looking at it. Inspection is part of the breast exam. Remember last module, we looked at the breast cancer and we looked at the dimpling of the tissue and the inverted nipple, just looking at the tissue and seeing what it looks like. So we're going to look at it. Examination by looking. Palpation, we're going to touch it, see what it feels like. Is it warm when it should be cold? See, I told y'all she was there. She goes, she's pulling up in the driveway now, just because I'm at home. See, get on my nerves, man. You know, I'm still mad at her from yesterday. All right. So anyway, palpation, you're going to touch it, see what it feels like. Is it warm when it should be cool? Is it wet when it should be dry? Is it rough when it should be smooth? Touch it, see what it feels like. Palpation. We palpate a person's pulse. In other words, we put our hand right there, feel the radial artery, and we count their heartbeats by palpation. Examination by putting our hands on it or touching it. Percussion, we're going to tap on it and see if we get a bounce from a solid organ or a hollow organ. For example, when the doctor taps on this side, you're going to get a different sensation than tapping on that side because your stomach's over here and the stomach is hollow. The liver is solid. So you get a difference in the sensations. If the doctor taps over here and it's hard, oh, that's a problem. Stomach's not supposed to be hard. If we tap over here and it's squishy, wait a minute, that's a problem. Liver's not supposed to be squishy. Or the doctor may tap on your face. Is that tender? Oh, yeah, it's sore. Oh, you got a sinus infection. So we tap on different things. And that's called percussion. Anybody play percussion instruments in school? Like some of y'all might have played the drum. Anything you hit, anything you tap on is a percussion instrument. Like the drums, the xylophone, or the ding, the triangle. Ding. How many of y'all played the triangle in school? You know you did. Ding, because you couldn't play shit else. Oh, just give his ass a triangle. Okay. Then you at home practicing, right? Wait a minute. Ding. Oh man, back play it over again. And you're missing the damn ding. Anyway. So that's a percussion. Anything you hit or tap on. And then finally, auscultation, to listen to it. And we're going to use a stethoscope to do that. To listen to their lungs, listen to their heart, listen to their blood vessels. Did y'all know doctors do that? You put the stethoscope right up here on their neck and you listen to their carotid artery. And you're listening for something called, that's pronounced, believe it or not, bruit. B-R-U-I-T, pronounce it bruit. When you put it up to their carotid artery, you'll hear a that's called bruit. It's a blockage in their carotid arteries. They've got plaque up in there. So we use a stethoscope to listen to all different parts of the body, even the stomach. Ever heard the doctor take the stethoscope and put it in the 4 quadrants of the abdomen? Listening over the different parts of the abdomen. And then right down here, listening for bowel sounds, stuff moving through their intestines. So that is auscultation. Auscultation, listening to the parts of the body. Examination by listening. Okay, and that is chapter 2. Now tomorrow, first thing, we have something very important to talk about tomorrow. Why is she leaving already? What'd she come home for? She leaving that fast. She just came home to pee. Y'all believe that? That woman just came in here to pee. Now she's driving off again. She wasn't here 10 minutes. Yeah, she came home to pee. Anyway, so, and driving my car. look kind of good in my car too. I need to tell her to stop driving my car. But anyway, inspection, palpation, percussion, and auscultation. Tomorrow, we're going to be talking about something very important in the first few minutes of class. So y'all will need to be here for that, especially if you want to get kind of a jump in there and get the good stuff. You'll know what I mean tomorrow. So that is the examination methods. We're going to go ahead and I'm not going to activate this quizzes or send out the review until tomorrow. I want y'all to concentrate on the infection control thing and get that done. So tomorrow, we're going to talk about something in the first few minutes of class. With the email I send out tomorrow, I'll activate the quizzes and send a review for chapter 1 and 2 and give you a due date for that. You'll have the weekend to work on that one. So the important information tomorrow morning, you're going to want to be here for that. So anyway, that is chapter 1 and 2. Tested on together as one test. Review and quizzes you'll get tomorrow morning. All right, so for the rest of the time today, we've got about an hour left. I want y'all to go ahead and work on your homework. And prepare for infection control quiz. All right, and lecture will resume at 8 o'clock tomorrow. Okay, I don't know if I'm going to be available during this last hour because I'm going to be on the phone back and forth with the school, and I may have to leave and run something over there. So I'll leave the core class open in case somebody comes back in later on and wondering what it is we're doing. So I'm going to leave this up on the screen. I may not be available for questions. You can call me out. I don't know if I'm here. I'll come in and answer. But go ahead and work on your homework. You can get quite a bit of homework done in an hour if you're just organized and just keep going. If you haven't done the quizzes yet, take about 45 minutes to study. And then in the last few minutes, go on and take that quizzes and get it done. I'm talking about the infection control bloodborne pathogens one. It's already there for you. So use this time wisely. I'll advise you again, whenever I give you time like this, do not go to sleep. This is not the time to go to bed or log out of class early. This is the time to get some homework done or get a quizzes done or something like that. So use this time wisely. Any questions before I step away?
Mr. Mahone.
Yes.
This is Angie. You know my situation.
Yes.
So is it okay if I leave class to go handle what I need to handle?
Yep.
Okay. Thank you very much, sir.
Any other questions? And by the way, I mean, I'm not saying y'all can log off if you want. I mean, I'm leaving it open just for any student who comes in late and wonder, wait a minute, what happened to the class? They'll see that what they're supposed to be doing. So you don't have to stay in class. No, you can log out anytime you want. I'm just leaving it open for that reason. So, use the time wisely, do what you got to do, and we'll see y'all tomorrow at 8 o'clock. Any other questions before I go? All right, we'll see y'all tomorrow. Oh, by the way, tomorrow's class will be over law and ethics. We'll be starting talking about the law and how it works. It'd be pretty interesting class if, we just make it that way. So we'll see y'all tomorrow.